This health news segment is brought to you by Memorial Sloan Kettering Cancer Center, dedicated to advancing cancer research, treatment, and care.
Well, we know that being overweight or obese carries health problems, but many people know that there's a growing evidence about the connection between obesity and cancer. Memorial Sloan Kettering nutritionist Cara Anselmo is here to help explain this link and what you could do to manage your weight and lower your cancer risk. Welcome to the program, young lady.
Thank you, Scott.
You know, when we talk about obesity, most people think heart disease, not cancer. Where did this come up?
Right. Most people know that there's a connection between obesity and heart disease and type 2 diabetes, but obesity is also a risk factor for about 10 different types of cancer. In fact, obesity might soon surpass tobacco use as the #1 preventable cause of cancer in the U.S.
Wow. So now what's been the correlation between obesity and cancer? Where did they come up with that research?
Well, research shows that being obese can create an environment in our bodies that contributes to cancer growth. We're still studying exactly why, but we do know that excess fat tissue is associated with increased levels of insulin, estrogen, and other growth-stimulating hormones, which can contribute to tumor growth. We also know that chronic low-grade inflammation, which is associated with obesity, can contribute to cancer development.
So I'm going to assume here that the thinner you are, the less weight you're carrying, the less of a risk it is to develop cancer. So what are some tips for people? You know, we've been hearing them since the beginning of time. What are some terrific tips that you can offer folks in reducing obesity and getting rid of that weight?
Well, it's not possible to prevent cancer 100%, but people can do things to lower their risk, make healthy lifestyle habits. Not smoking is key, but of course maintaining a healthy weight is important. I would suggest starting with a balanced diet that includes lots of whole vegetables and fruits, lean proteins in practical portions, limiting added sugars and refined carbohydrates, and perhaps most importantly, eating less overall. I find that many times people aren't eating foods that are unhealthy per se, they're just eating too much of them.
Now, what about, you know, obviously exercise is in there, but some folks who are very overweight, that's tough to exercise. Is even just some movement helps in burning some calories and getting rid of some of the weight. You know, what can somebody do to get started, at least to just get motivated to do this?
Well, yes, as far as exercise, anything is better than nothing, and the more the better for most people. So I encourage it because not only does it burn calories, it also helps to improve your mood, it helps to boost your energy level, and it refines your awareness of when your body is hungry and full, and that all helps you to eat smarter and not overeat.
All right, Cara Anselmo, thank you very much. Now,